On this chilly morning, people are out enjoying the sunshine, playing football. But scientists advising the government are warning that measures may need to be even stricter to fight the high numbers of COVID cases we're seeing now. Looking at the restrictions we have now, are they good enough?
It looks as though they probably aren't. March was able to get the R value down below 1 to about 0.6. But the new variant of the virus is more infectious than that. So even if we were to have restrictions similar to what we had in March, then I suspect we probably wouldn't be making much headway against the virus.
This is why the rules matter. Last night in London, ambulances struggled to fight through traffic to get their patients to hospital. The capital's ambulance service taking 8,000 calls, when on a busy day, they would usually see just over 5,000. And in the light of day, their workload is only going up. Here at Homerton Hospital, the pressures are increasing, like hospitals across the capital and across the country as well. 2/3 of beds here are taken up by COVID patients, and Public Health England have told us that they're increasingly concerned.
We estimate that today there are more than 8,000 Londoners currently getting treated anywhere across the system in London, and more than 900 people are in intensive care. And because our epidemic in the city is still growing, is still showing signs of growth, those numbers will continue to increase.
And it's this worry that has scientists calling for action. What restrictions do you think the government needs to put in place now?
I think that it needs to rethink the collective worship situation so that those are not potential spreading events. I think it needs to absolutely emphasize the 2-meter rule when people are outside or inside. And I think it needs to look at its support for people so that they can self-isolate when they have symptoms or have been in contact with someone with symptoms.
The big difference between the situation we were in the first lockdown is vaccines. This afternoon, Buckingham Palace revealed the Queen and the Duke of Edinburgh have received their COVID vaccine, joining the 1.5 million people who've had their jabs so far. Across the country, the NHS say that time is critical now.
With the way that the pandemic has been going and the stage of lockdown we're in right now, we need to protect as many people as possible, as quickly as possible.
But there were hiccups in Lewisham in South London yesterday, with over 80s queuing around the block at a GP's waiting for theirs. With the death toll passing over 80,000 today, comes a renewed plea from the government to act like you have the virus, to try and stop the spread.
Well, we're joined now by Rupert Pearce, a frontline ICU doctor in South London and a member of the Intensive Care Society, which is a professional body for intensive care staff across the UK. Rupert Pearce, from where you're standing, does the Queen getting the jab help combat disinformation, do you think?
Well, I think vaccination is got to be our best hope of getting the pandemic under control and some sort of return to normal life. And I think it's great that any role models that are visible to the public who show that they're happy to have the vaccine, show that the vaccine is safe and will certainly be a much better outcome than COVID, I think is good for the whole of society.
And when you yourself are confronted by COVID deniers or anti-vaxxers, what do you say to them?
Well, it's difficult. Some people really don't want to have a conversation and listen. I try and focus on the people that are prepared to have a discussion, perhaps listen to a point of view and understand it. But there are a lot of people out there who genuinely just don't have the facts at their fingertips. And if you treat them with respect, they're prepared to have a conversation and often they understand my point of view.
Well, if anybody's listening now or watching now who might be a bit sceptical, what can you tell them about the situation in your ICU, in your hospital now? How many spare beds do you have?
Well, we're opening new beds all the time. So this idea of spare beds is a bit of a confusing concept, and it's been widely used to misinform the public, in my view. But the main thing I would like to get across to the public is, of course, you will not see COVID patients in the corridors of hospitals. Of course, you won't be able to go in and walk in and see those patients because, for obvious reasons, we're keeping hospitals as empty of people as possible. And where patients do have a very infectious viral disease, we put them in a ward where it's very hard to get into, so that they don't infect staff who aren't protected with PPE, and they don't infect other patients who don't have COVID. And so it seems to me really obvious that you're not going to come across those patients easily.
And your normal ICU beds are all completely full, and you're now reopening beds wherever you can in other wards, right?
We've more than tripled the number of ICU beds in my hospital, and that's a pattern that you'll see repeated across London. And this isn't just a London problem, it's very much a UK problem. We're very nervous to see the virus spreading north. I'd also say it's not just a problem of intensive care. We've got some amazing colleagues in respiratory medicine, geriatric medicine. Ambulance crews are doing absolutely amazing work, and GPs as well.
And are there people who, despite the fact that you've expanded all those extra beds, tripled the number, are there people who this time last year, or even in the first wave of the pandemic, would have got an ICU bed who won't now?
So every time I worry that we might reach that threshold, we seem to find a new resilience, a new set of resources that allows us to open more beds to find new solutions to the problem. We have not met a phase at any point in the pandemic so far where we did nothing other than offer an ICU bed to every single patient that we thought would benefit from that. That's still the case right now. ICU doctors are obviously really worried that that might change. And one of the reasons I'm talking to you tonight is to help get the frontline situation across to the general public so they understand the urgency of following the public health measures, so that we've got time to get a response in.
And in terms of following those measures, do you think there need to be stricter measures, fewer exemptions, you know, kids not going to nursery, things that are currently open, like, I don't know, garden centres not being open? What's your view on that?
So I'm not a public health expert, but we have some absolutely superb public health experts in the UK. And what I'm doing is following the instructions that I've been given. As a member of society, I'm following the rules, the government guidance on what we're supposed to do. And I think if everybody did that strictly, we'd be a long way ahead. In particular, we're seeing lots of people who get infected in family groups within family homes. And I think that's one of the most important things to emphasise. It's not just in the high street, in the shops and so on. People can get infected anywhere.
Rupert Pearce, thanks so much for joining us.